All right, now let's take a look at what we would like you to achieve by the end of the rotation. We have 4 major goals: comprehensive pediatric histories and physical exams, organized medical documentation, enhanced medical knowledge, and effective communication. Here's how we're going to get this done. You will be observed obtaining histories and doing physical exams by your senior residents and your attendings. You will also receive feedback on these skills. The more you ask for feedback, the more you will receive it. We will assist you in feeling comfortable in some things that might be new to you, such as how to examine a child, growth, development, immunizations, pediatric diet, and pediatric milestones. We have created 2 epic smart phrases to help you get started with medical documentation: .hppeds and .ip progress note peds. They can be borrowed from Stephen Bach's smart phrases. If you have trouble locating them, ask your attending. Remember, your assessment should always include both a rationale for your leading diagnosis and also your judgment about the current clinical status. Are they improving, worsening, or the same as before? Your plan should be divided by problem or system and address specifics including monitoring, further diagnostics that are needed, medications and why they're being used, and any discharge criteria that the patient needs to meet before being discharged. Through patient care and lecture, we hope to enhance your medical knowledge on the following topics: asthma, bronchiolitis, sepsis, meningitis, appendicitis, electrolyte imbalance, seizures, croup, diabetes, urinary tract infections, failure to thrive, pneumonia, gastroenteritis, cellulitis, and hyperbilirubinemia, among other diagnoses. How to approach respiratory distress, abdominal pain, diarrhea, fevers, rash, headache, limp, altered mental status, vomiting, murmurs, lymphadenopathy, anemia, hematuria, proteinuria, and shock, among other symptoms. And finally, the appropriate use of analgesics, antipyretics, antibiotics, bronchodilators, corticosteroids, and IV fluids. We may not see all these things while you're on your rotation, so these are all great things to read about as well during your free time. As discussed earlier, we do family-centered rounds on pediatrics, meaning we present in the room with nursing and the families present. The team may quickly round outside the room to make sure everyone is on the same page prior to heading into the room. It's best to explain this concept to the families during pre-rounds so they are not surprised or overwhelmed when everybody comes into the room. If you are presenting, you should introduce everyone on the team to the family and then introduce the patient to the team. Start the presentation by saying that you're going to summarize the case and make a plan for the day. It's okay to pause during your presentation to explain any medical terms or labs or medications that the patient is taking. At the end of your presentation, be sure to ask the family and patient if they have any questions. For a patient that is new to the team, use the following format: identifying statement, HPI, pertinent past medical history, medications, exam, labs and imaging, any updates to the exam or labs and imaging since admission, differential diagnosis, assessment, and plan. For a patient that has been presented before, only do identifying statement, overnight events, a concise exam with diagnostics, current medications, and assessment and plan. Other communication skills to work on during the rotation are eliciting and answering families' questions, discharge teach-back, which is how we make sure families understand the medications they're taking, their follow-up, and when to return to the hospital, discharge phone calls, updating nursing about new orders, and signing out to the night team. Woo! That's a lot of stuff, but we can do it. May the force be with us. Please proceed to the last video, evaluation, feedback, and teaching. Almost done!